What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, February 25th, 2025. If you're new to my channel, welcome to my channel. This is the channel where I do daily virus updates on all those viruses that can make us sick. Let's face it, when you watch the news, you get the local news, you get the sports, you get the weather, and very little health information in between. Well, that's where I come into play. I give you anywhere from 15 to 25 minutes worth of coverage on all these viruses that can make us sick. There have been a lot of viruses this winter, and it's a problem. Deaths from the viruses are starting to go up. We're going to see several things in the data today, several news stories that suggest flu deaths are on the rise here in the United States. Want to stay informed with what's going on? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Let's try and get to 10,000 subscribers on this channel by the end of the year. That's my goal for this year. Wouldn't that be something? 10,000 people following. That would mean I'm doing something right, and I'm keeping you guys informed. Already, this morning, it did not look like a very busy news day. This afternoon, things have changed. It is a very, very busy news day, so let's get right into it, shall we? Starting off with this. Federal health agencies restore web pages and data sets following judge's order. That's right, some of the pages that were supposed to, go down, and they did. Some of the pages that were down, a federal judge has now ordered that some of that data needs to come back. Not all of it has come back, but some of it has come back. It's a step in the right direction, of course. We got a long way to go. All right, norovirus outbreak sickens nearly 120 guests and crew on a Holland America cruise ship. And I get this, a norovirus outbreak on a Holland American line cruise ship sickened nearly 120 among 2,614 guests aboard the line's Rotterdam ship. 107 reported being ill during its current voyage, along with a dozen crew members, according to the Centers for Disease Control and Prevention. Their main symptoms were vomiting and diarrhea. This was a 12-day cruise that was expected to go from Fort Lauderdale, Florida, on February 2nd. And it looks like it was supposed to go through the Panama Canal. So, not good to see that. We've seen several cruises already this year. I don't know if we reported this one already or not. I saw a lot of news stories about it saying it updated today. I don't know if this is the same one from a few weeks ago. Either way, you know what? I wouldn't go on a cruise ship. I say it every time we get one of these. Cruise ships are just petri dishes for these viruses. All right, United States records highest whooping cough deaths in decades. What is this deadly infection? Well, as you know, pertussis has been a problem over the last few years. It's been trending back upward once again. And the United States confirmed at least a dozen deaths from whooping cough infections, according to preliminary figures released this week by Centers for Disease and Control. And whooping cough is also becoming more of a problem now in Wyoming. Yes, whooping cough cases are on the rise in Wyoming. Department of Health says so. This is not a good thing whatsoever, and it's rising in multiple counties up in Wyoming. Moving on to this. Multiple avian flu cases have been reported in wild birds in southern Maine, officials say. Yeah, this is not a good thing whatsoever. Wild birds are being found in towns like Kennebunk, Kennebunkport, South Portland, York, South Berwick, Unguit. So, yes, there is a problem with H5N1 up there, and I hope this does not get into the loon population. That would be really sad. A lot of lakes up there tend to have, loons in the summertime, and then, of course, they go to the ocean in the wintertime. Would be really sad if that sound of the Maine loon, or the loon in general, is not heard in Maine anymore because of H5N1. But I gotta be honest with you, it is possible that's something that we see happen down the line unless we do something to contain H5N1. Moving on now to this. Nearly 15% of long COVID patients have cardiovascular symptoms, most often chest pain, and this is nothing new. If you've been following my channel for a while, we have seen reports like this before, a high blood pressure, and this is not a small study. This is involving 37 studies with more than 3 million people. So, yes, this is legitimate. This is based on everything you see here in my videos on the channel. The data is real. These are facts of things that are really actually happening. You know, flu cases, flu death, COVID studies, post-COVID issues. This is all just raw data that's coming from legitimate sources such as CIDRAP. They are well respected, so yeah, this is not a good thing whatsoever to continue to see more and more studies come out that confirm things we already know. It just shows COVID, it can really cause a ton of long-term issues and post-COVID issues. This study and everything else you see today will make it on to my website. There'll be an archive of there'll be a post for today with all the news stories because we do have several more to go. In New Mexico, Department of Health confirms cases of measles in Lee County. The department urges residents to update their vaccinations. Yes, a week after the New Mexico Department of Health warned of an outbreak of measles in Texas that borders New Mexico, the Department of Health announced a confirmed case of highly infectious disease in New Mexico. It has spread, and there's a whole bunch of potential exposure times. Again, this post will make it onto the site. I already did post it on X. You can find it that way as well with a link to the article. Moving on now to this. I believe this is in Minnesota. Yes, it is. Park Square Theater cancels upcoming songbook series due to serious illness. They don't state what the illness is, but this is in downtown St. Paul. We're at the Park Square Theater. So, yeah, you're not going to be able to see this at this time because there's a serious illness going on within the staff. Who knows what that could potentially be. Now get this, and I have to move this back up here. Flu deaths in the United States are actually outpacing COVID deaths in 22 states for the first time since the pandemic began. That's right. That's how bad flu is this year. Flu is really bad. We're going to see more about flu deaths going forward. In North Carolina, 2 children and 56 adults die from flu-related illness as virus continues to spread. Now, you may be thinking, oh, that's their seasonal total so far. No, I thought that too at first. Let's read. Raleigh, North Carolina. New data from North Carolina Department of Health and Human Services, NCDHHS, showed that 2 children and 56 adults died from the flu since last week. That's just in 1 week. That's really bad for flu numbers. In fact, that's something more similar we would see to COVID. So I would assume North Carolina may be one of those states where flu is starting to outpace COVID for the time being. Not to say that COVID isn't bad. We just did not have as bad of a COVID wave this winter. If we have a bad wave in the summer like last year, guess what? Yep, once again, COVID's going to lead the way because we don't see high COVID deaths or we don't see high flu deaths in the summertime. We do with COVID sometimes because we do see those summertime waves. All right, moving over to this. This is also North Carolina, Charlotte, North Carolina. This was posted on my site, coming from a news story, by Guy from North Carolina, and it says, Charlotte, North Carolina, Queen City News. The number of flu cases across the country is at the highest level since 2009. We know that. But, get this, emergency rooms and hospitals in Charlotte are also feeling the spike in flu cases. And a doctor there says the high number of cases is very likely impacting how long everyone must wait in the emergency room, and COVID could be making a comeback. So there's a whole bunch of things going on there, and the main takeaway is they are overwhelmed with flu cases in the hospitals as well. Alrighty. I was going to do a little segment today debunking all these rumors that are going on about Indiana on X and elsewhere. I've seen it elsewhere. I've even seen it on Facebook. There's rumors going around that H5N1 is filling up the emergency rooms with human cases in Indiana. Well, right now, I can tell you We're not seeing that. I have not seen anything from the CDC. I have not seen any credible source actually say that. Here's what I am seeing about Indiana. Indiana reports highest flu activity of the season with 57 deaths, and I believe this is the seasonal total so far for flu deaths. What I am also seeing, and I'm going to show you some wastewater in a little bit, wastewater data suggests flu levels are high there, but what we are not hearing about is it actually being confirmed reports of H5N1. So until we see something from the CDC or a credible source, it is just influenza A being very high, like what we're seeing in many parts of the country. And quite frankly, I don't know how much they are actually subtyping for it there, so, or checking for it. So who knows? But what we do know is influenza A itself is what is the core problem, which is why hospitals there are busy. And to be honest with you, when you take a look at the hospital capacity page, they're actually not as bad as some of the other states. They're not even over 80% on the latest update. So right now it's just influenza A being much worse than usual. Speaking of influenza A being worse than usual, this is not good. New York State, 3 more children have died from flu, raising New York's death toll for pediatric deaths to 9. So yeah, not a good thing. And something else not good. Get this. Sometimes when you see a story, something like that, you learn more things unrelated or similar to it within the story. And here we do that. Here in New York, the state has confirmed roughly 300,000 flu infections and about 20,000 hospitalizations. And I've said this time and time again, prior to the COVID era, prior to people getting tested for COVID and at-home testing, how many people can raise their hand and say they actually went out and got tested for flu? Some can. Many can. But guess what? More people do it now than they did before. And with that being said, this is probably missing in many cases. So the fact it's reached 300,000 cases and 20,000 hospitalizations, that is really bad. Because I know for a fact myself, prior to the COVID era, I probably do not remember ever getting a flu test. I don't think I did. I suspected I've had flu back in, I think it was 2016, because I was really sick for like a week, but I didn't get a flu test. Didn't have an at-home flu test. That wasn't even a thing back then, at-home flu testing. It is now because we have these multi-test rapid tests that are out there. And, of course, I'll show you this. USC's no let-up in rising flu activity. The positivity rate nationwide is 31.6%. And we have now seen 310,000 hospitalizations and 13,000 deaths of the virus. And that is just from February 7th. That number is likely up when we get this week's update later in the week on the nationwide level. All right, we have a couple school closing announcements today, showing you this on my website. I'm slowly catching up. I'm now just adding in the new ones that I find. There's still more of the older ones that I have to add in yet. It's been a very bad winter for school closings due to illness. Usually you think of school closings for snowstorms. No, illness school closings have been absolute insanity. I'm now on page 5 of this thread. And in Greensburg, Indiana, St. Mary's Catholic School in Greensburg will be closed due to just a high number of illnesses Thursday and Friday. And in Brown County, Tennessee, there is a school closing as well. In Canada today, we do find a viral activity level for COVID-19 is moderate. Flu A is high. Flu B is listed at moderate. And RSV is listed at high at this time. All right, taking a look at what is going on with air quality today, and we're going to see a mixed picture. There's some moisture in the east, and as we know, moisture often messes up the air quality sensors, and yeah, from the Great Lakes to the Mid-Atlantic, even part of the Northeast, we do see air quality problems showing up today, and still a few problems on the West Coast as well. Taking a look at what's going on in Florida, and yeah, I didn't think that was right. Let me refresh that. There we go. We do see multiple calls at this time. 1, 2, 3, 4 sick person calls. I think at least 4. Actually, no, make that 1, 2, 3, 5 sick person calls. So that's not good. And a few other things mixed in. In Philadelphia on Tuesday, 779 EMS incidents. Let's do a look in at what's going on right now in the suburbs. Hopefully things are better. Montgomery County looks a little better, but yet again, we do an update and there's a cardiac arrest call. Norristown, Pennsylvania, cardiac arrest. Chester County was really bad earlier. I hope we did. We've lost the scroll bar. There was a scroll bar there a little bit ago, but look at this. Chester County, also a cardiac arrest call. I've been noticing a big increase in cardiac arrest calls lately. And, there was a report on Inside Edition last night how, the Super Bowl weekend, during the Super Bowl game, there's an increase in number of heart attacks and cardiac arrest just from the stress of the game. True. It can happen, but I'm also noticing in general it's gone up since the start of this winter wave of viruses. Not a good thing. We do see multiple sick person calls as well. In Pennsylvania, you know what? I can actually say the hospital situation, while it's not perfect, it's not as bad as it was yesterday. We're seeing less hospitals in the Lehigh Valley, still has some, Southeast PA, just a couple in South Central PA. In New Jersey, okay, this is not good either. And what's going on here in Jefferson, Washington Township Hospital? Emergency department, 88 active, so that means 88 people in the emergency department, I think. 17 in ED borders, 27 in the waiting room. Waits over 3 hours. That's not good. And Princeton Medical Center is also doing, a full emergency department divert at this time. So that is also not a good thing. All right, continuing on our discussion of flu. Pennsylvania this week, or I should say this season, has 256 influenza-related deaths have been reported in Pennsylvania by the National Centers for Health Statistics for the 2024-2025 season. I suspect that number is going to continue to go up because flu levels continue to be very high here in Pennsylvania. RSV trends is decreasing at this time. Flu was increasing, by the way. And COVID-19 trends, emergency departments, they're low statewide, but quite frankly, when we see Charles, CJS, give his reports, we get something different. There's a very high number of people using the hospitals for COVID in my state. So we'll see what happens later in the week when he mentions that. Taking a look here at this. Look at it. This is ridiculous. Flu A, just in 1 week. 26,585 cases. Flu B, 667. RSV, RSV, 2,364 cases reported in 1 week. So, flu is really bad here as well. National positivity rate for COVID is 10.2% this week. And let's take a look at the national positivity rate for flu A, and that is 7.11%. All right, let's get to some good news, shall we? Everybody likes good news. I want to give you some good news. Chicago, though still high for influenza emergency department visits, take a look at this. It is dropping. The positivity rate, 22.6%. That's still really high. Still a good chance that you probably could get infected because spread out there is still very risky, but it's starting to drop at least. RSV starting to drop. Emergency department starting to drop. RSV positivity rate is 4.5%. COVID is 4.8%. And activity level is low for COVID. RSV is still high at this time. I mean, I gotta give some good news when I can. All right, let's take a look at some wastewater in Indiana. Let's go to Carmel, Indiana first. And we can see here, COVID is listed at medium. RSV is listed at high. And we can see here, influenza A, while it was high, and it still is, it's starting to show signs of maybe peaking a little bit. So we're not seeing it go straight up. Again, you're going to see some misinformation out there. There has been so much of it. It really annoys me when people start these rumors without actual sources of information. I see so many people post things, and then they will not post a source saying, oh, well, this person said that. No, if you have a rumor like that, please post a credible source. Post a link to the source. It needs to be done. HMPV is high at this wastewater site. Norovirus now, that is a big problem. Norovirus is really, it's rising once again after it did peak on January 15th. And it's the double peaking, the second peak that's coming soon, hopefully. It's going to be equally as high as it was before. That's something that's really bad. Let's do one more wastewater site let's go down to near Bloomington, Indiana. What's going on there? Now, this is not good. COVID's starting to go up once again. RSV is dropping a little bit. Influenza A, it's pretty high there. And it may be starting to slow down a little bit, or so I hope. Influenza B did rise as well. HMPV is low. EVD 68 is low. Norovirus. It did start going up again now. Maybe it's going to drop a little bit. And there was a detection of hepatitis A. All right. I wanted to show you this real quickly. I wanted to show you more of this, but then I found all these news stories that we looked at today. So I'm only just going to show you the national level. Maybe tomorrow, if it's not a busy day, I'll show you more. It probably will be busy tomorrow. Respiratory illnesses across the United States are listed at very high at this time. Emergency department visits for COVID are low and decreasing. Flu is rising and very high. RSV is moderate at this time. Wastewater viral activity level in the United States for COVID is high. Flu is very high. And RSV is moderate. Here's a good takeaway from this, and some may not like me saying this, but I have to say it as it is. COVID-19 is very high in wastewater. If this was a couple years ago, COVID being very high in wastewater would not equal low emergency department visits. There would be a lot more emergency department visits. It shows how far we have come, but we have not come far enough. We all know long COVID is real. Heck, I deal with long COVID issues. And we all know that catching COVID again and again can increase your chances of long-term issues. Alrighty, moving on. Taking a look at this. New York State, 701 new cases. Something interesting did happen today, though. Unlike last week, the second update of the week shows that there was an increase in hospitalizations. 851 people hospitalized and 70 people in the ICU. So that is something we obviously have to keep our eyes on. And while we're at it, let's look at New York City. I want to know if they went up today. Let's try this again. Here it comes, New York City. And yeah, New York City did go up today as well. 298 people in hospital, 18 people in the ICU. The ICU number only went up by 1 in New York City. All right, now taking a look at some numbers that were given to us from CJS 83172. Florida, this is a daily number. New cases, 815. This is all for COVID now. New Jersey, weekday number, 2,178 new cases and 5 new deaths in a 4-day update. New York, yesterday had 1,021 cases reported. Remember, anything from New York is lagged by a few days. Puerto Rico, 297 new cases and 1 new death. Puerto Rico cases may be starting to go upward. Maine, 330 new cases and 12 new deaths. Maryland, 1,539 new cases and 26 new deaths. It would sure be nice to see Maryland get under 1,000 cases in their weekly update, but not happening. And Maine was also a weekly update as well. We need Maryland to start dropping. We also need Michigan to start dropping. Michigan added 3,651 new cases in a week and 50 new deaths. Some of that death increase, 50 is a net number because that takes into account 16 from 2022 to 2024. Virginia added weekly number 4,168 new positive tests, including 3,986 from the week of February 2nd through the 8th, and 31 deaths reported by the CDC data tracker last Friday. Again, we would like to see Virginia's numbers start to drop as well. And remember, that does not include these guys right here. The at-home test doesn't include them. So, yeah, that is problematic. Alrighty, folks, that does it for today's virus update. We'll have another one tomorrow. I'm sure tomorrow will be a busy day as well. We usually get the UK, we get Ohio, we get a few other things, and, well, you see the way the news is going. It may look like a not-so-busy news day first thing in the morning, and then by afternoon, there's all these news stories that pop up. If you enjoyed this video, give it a thumbs up. Subscribe down below. Help me reach 10,000 subscribers. I want to keep as many people informed, aware, and safe as possible. Hit that notification bell, share this video with anyone you know, and of course leave all your comments down below. I love reading and replying to your comments. I'll see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Wednesday afternoon. Thanks for watching.